Yeah, so any idea which task?
One Bob Aaron. The next one is towards John.
Bob Warren. Bob Warren was actually a very good sample that you're writing to a community health nurse. It seems to be a very simple task, isn't it? Yeah, I hope it is simple for everyone. Yeah. Okay, guys, I've muted some of the voices because of the background noise. So you can unmute yourself in case if you have any questions or query. I'm still waiting for Nibha to join. Maybe she's still on the way. Okay, let me just try. All right. Yes, Rekha, how are you doing?
I'm fine, thank you, Jesseline. How are you?
Good, dear. So what's the time there?
Say it again.
What's the time there?
Oh, it's 3 o'clock and beautiful sunshine. Enjoying
Wow,
the
good.
weather.
Very nice, because that's very rare at your place, isn't it?
Yeah, it's cold all the time. Oh, it looks
So
like
you're
lively
enjoying this.
today. It's
Yeah,
lively
so you're
today.
right. So sunny day.
Yes, it is sunny day. Enjoying
Yeah,
it.
very nice, very nice.
How are you?
Okay,
Where are
all
you?
right. Yeah, good. So I'm in here. It's now 8:30 evening. Had my dinner. So free from there.
You know what time we have our dinner? 6 o'clock in the evening, and that's it.
Oh,
Not
wow,
before.
that's really a great time. I believe I do. I mean, this is because today I had it 8, but it's on Sunday, but other days we usually have it by 7 o'clock. 6 is too early, but yeah, we do it by 6:30 or
Yeah.
7, in between that. That's
No,
really
before that.
cool actually.
Yeah.
We must eat early. I mean, I also avoid eating after 8 o'clock. If I'm late than that, then I won't take.
Yeah, because we will stop our tummy. We're gonna take time to digest all the food. We had it already. So we just give it time
Absolutely.
tummy to relax.
Uh-huh.
And then by the time go to bed, tummy is already adjusted. Everything is being done. So it's relaxed as well with us.
Oh, great,
Some
great,
no
great.
need to do extra exercise.
Uh-huh. Yeah, that's really great. Actually, last time when I was just a few days, probably 2, 3 days ago, I was in Delhi. So I went to INA market, which is a very famous market for all the culture, but especially among South Indians. So since I'm a big fan of South Indian food, I went there because I remember there's one famous Kerala hotel. So they made homemade pickles. I brought mean pickle. Mean means fish pickle from there.
Okay.
So
Uh-huh.
now, until unless that bottle will finish, I will force myself to eat rice, and otherwise I don't eat rice. But with that pickle, I need rice, and I eat all the 3 times. My mother is like, "How can you eat so much of rice?" Because of this pickle,
Hey
I mean,
Anna.
I can't sleep without eating that. I can eat this pickle even just with the spoon like that, without anything.
Oh, tell your mama I'm South Indian now.
No, Mama is not there. I bought it from market.
No, I know that. Just tell your mom I'm South Indian now. I'm trying their dish, so I am.
Oh, is it?
No, no, just said it your mom. Just like in a joke way. The mom, I'm South
Oh,
Indian. That's why I like
okay.
that.
All right, okay. All right, so great. Um, yeah, good to back this letter I was trying to find out. So I got this letter. So first I wanna discuss about I hope, and let me see if you guys can see the screen. Okay. Yeah, I hope everybody can see the screen. Yes, guys, can you see the screen? There is a writing sub-test which I've shared. I hope it is visible to everyone.
Yes, ma'am.
Okay, thank you so much. So I'm just going to discuss that how do we organize the task and how we transform the case notes and what are the things which are relevant we should include or we shouldn't include. Okay, so as you can see on the top of the page, it is clearly written that you have time allowed, reading time 5 minutes, writing time 40 minutes. So during this 5 minutes, you are not allowed to touch a pencil. So you just have to read the whole task and do organization. 5 minutes are more than enough to plan your letter. However, I always recommend to take extra another 5 minutes when you can touch the pencil after another 5 minutes and then write and plan and do a rough work. Always try to write your introduction in the on the rough page. You will have a rough page, okay, and then finalize it on the paper instead of just starting. Never start directly writing. Always take some time, think, plan, do a rough work. That this is how I'm gonna write my intro and then plan. Okay, so what we do in this 5 minutes, how to read this task, like from where it starts, the first line says that Mr. Job Warren is a 73 years old patient in your ward and you are the charge nurse. So first question, there are 3, 4 questions which you need to keep in mind. The first question before you start read is to ask your mind is, who am I? Who am I? Okay, so please note down those who are, if you guys are making your notes. And so the answer I have, my name is not given, but it's just given I'm a charge nurse. And the patient name is given that job Bob Warren, 73-year-old. All right. Now this I have my name, I have patient name, and third question, most important is to whom I'm writing. To whom I'm writing, right? I will just read this first line and go to the last page of the letter. I will not say you to read it all the page. So just go to the second page, which is the last page. Now you look here, it is written writing task. Yeah. At the end, it is written writing task. So just read the first line, go to the last line, which is writing task, read that, what it says. It says, using the information in the case notes, write a referral letter to Mrs. Gillan Doré. So I got my answer. To whom I'm writing? Gillan Doré. Name is given. Who is she? She is a community nurse. Now, where I got the clarity. So I'm writing a referral letter to the community nurse. Address is also given. This medical center, Alban Road, Sandhurst, okay, outlining relevant information for the continued care of Mr. Warren. Very clearly mentioned. Continued. So, care of Mr. Warren. So, I got my answer. The third question is to whom I'm writing. I'm writing to community nurse. So, name is Dore. And then why I'm writing, the most important question, the fourth is why I am writing. I'm writing to request for continued care of Mr. Warren. Okay, I got my idea, but I still feel that I have my purpose is so why I'm writing means purpose. So this is one of the assessment criteria. So the purpose should first, in fact, the first assessment criteria of writing is purpose. So you need to define your purpose very clearly. So it is just written continued care. Now, what kind of a continued care? What happened to a patient? For that, I'll go to the rest of the letter and we'll read. But before that, I will just to get the clarity about the purpose, I'll read the discharge plan. Sometimes the purpose is not clearly mentioned in the writing task. Sometimes that at that time you need to read the discharge plan. So make a habit after reading the writing task, always read the discharge plan because that will give you more clarity about the purpose. All right. Now the purpose says first point is written under discharge plan. Community nurse to visit home and change dry dressing daily until removal of stitches. No.
Guys, I hope I'm audible to everyone. Hello. I just want to check I'm audible to everyone. I'm not just talking.
Ma'am, there is some disturbance, ma'am.
Yeah.
Yes, you are.
All right. Thank you. So, you know, I don't want to realize at the end that I just finished the task and nobody was there. Okay. All right. So the first line gives me a very good clarity that I'm requesting basically what kind of a continue care. The continue care is for the daily dressing. So I'm requesting for a home visit. I got a very good, nice line to write in the purpose that I need a home visit request for a community health nurse to change the dressing. All right. Second is given monitor. Guys, please mute your voices. Okay. All right. Second is monitor compliance with exercise program. All right. So I have to, that means always keep these points in mind because that means you need to choose the about her exercise also. Okay. Third, about pain medication. That means I have to include medications as well. And when necessary, okay, BP monitoring for 2 weeks. Compression stockings to be worn until review. Okay. Medical equipments provided home. All right. Patient instructed on wound care must be kept dry until the stitches are removed for next 6 weeks. All right, I got a very good clarity now that I'm gonna request a home visit to the community nurse for not only daily dressing. There are a lot of other things. So probably I can write the word for the continued care of Mr. X after this discuss, followed by his discharge. So five. Now these questions, what you need to ask your first is who am I? First got that answer. Second, you should go to about the patient line. Third, it's not that important anyhow. The second most important question is to whom you're writing. I'm writing to the community nurse. Name is not that important. The person designation is important because your letter based on that. Okay, community nurse. Immediately I'll understand. Okay, community. Okay. Now, third, why I'm writing the purpose is very clear. The purpose is for continued care. And fourth is the type of letter. Now, since it is very clearly mentioned here, it is a referral letter. So that means referral means the first time you're writing. Now, sometime, please keep it in mind, it's sometime it is clearly written in the writing task that it is, for example, it is written here, write a referral letter to Mrs. Terry. Now, but your letter, if you will read, will say that it is sounds more like a transfer letter. Okay, let's say in the discharge plan, it is written transfer the patient to this. Now you will be confused. What should I write in intro? Either I'm writing to refer this patient or I'm writing to transfer this patient. So the better and safer word is I'm writing to request you. Use the other word. Request sounds better. I'm writing to request your home visit for Mr. X, who requires your continued care followed by his discharge today. Presently, he's recovering from XYZ. Now, that I need to see what his current problems are. So this is how we plan an introduction. I hope it's clear to everyone. So you will have these questions answer you should have in initial 5 minutes. So if you feel that you still have a time in, because anyway, you will be able to read this and choose this in 5 minutes. So what you will do, these things you can do in only 1 minute or 2 minutes. Then go back to the, let me just see, yes. Okay, Now go back to this page and see, then read all the letter to get the understanding, which says the date of birth is this. Now I will choose what is relevant and what is not relevant. So the things which are non-relevant, I will put a cross. The things which are relevant will tick. Okay, so of course the patient name, date of birth, yes, admission date, he admitted on 12 June 2017, were discharged on 16 June. Just roughly draw a bracket and just roughly write a days. How many days? 12 to 16? 4 days, right? So I will roughly just write 4 days. Okay, so he was admitted for 4 days. All right. Reasons for admission, very clearly written, right total knee replacement, TKR, very clearly mentioned. So I can very smartly write, as I said, now I can make my introduction because the situation is clear to me. So I can write, I'm writing to request your home visits for Mr. Warren. If you want to write the full name as well, you can, but it doesn't matter you write the full name or just the last name. Both are correct. Both the ways are correct. So I'm writing to request your home visit for Mr. Warren, who requires continued care after his discharge or followed by his discharge. Uh, he is recovering from right total knee replacement surgery. Or you can also write he underwent right total knee replacement. All right, both the ways are correct. Now, moving next is written marital status, married to Warren, 64-year-old ex-school teacher. Now I need to ask, it is a referral letter. That means that community nurse is not aware about this patient. It's a new case. New referral means always a new case. Remember that. Okay. So in that case, I need to share social history so I can tick this information. Social background, lives with wife, 2 dogs in a 3-story house. Is it important for the person to community health nurse to know? Well, what I will do, I will just put a dot on this. If I feel that my letter is getting short, then I will mention. Otherwise, I don't feel that dogs are important to mention. Okay, so 4 adult children, 2 children lives nearby. The daughters were in visits regularly. Rare see son resides Hong Kong. So then the son who is not staying with him, then I don't need to mention about it, right? So I don't find this is important. So I'll cross it. I can just mention he has kids. That's it. So wife supportive. No, sorry. Yeah, wife supportive, does all cooking and housework. Okay, so this is a good thing. I can mention that the wife is supportive. He was car mechanic and then retired a year ago. If he's already retired, why do I need to mention that he was car mechanic? That's not important. Okay, I'll cross it. I enjoy working. Okay, enjoy walking dogs, watching football. These are hobbies. All right. I'll see if I have the space to write. Otherwise, I again put a dot here. Enjoy red wine. Feeling depressed recently. Feeling stuck on house. Now this is what these all are the routine things. Anyway, see now this is what you need to keep in mind. Where I'm saying you to put a dot. Now, social history, you will feel that it's important to mention about the kids, dogs, these things. But again, I'm writing to a community nurse, and that to nothing something for a socialization or some other purpose. The purpose is very clear for the dressing, which is for 2 weeks, and other things which need to monitor just approximately 6 weeks. So she's not gonna stay there permanently. She's not gonna make permanent acts with the patient. So I will only mention the things which are related to the current condition. Okay, so I feel that red wine and Indian takeaway is not that important. I'll delete all this information. Feeling depressed recently, feel stuck in house on waiting list for physician surgery for total 3 years. Well, not that, but yes, you can mention that he was depressed for the surgery as he was waiting for last 3 years. You can. So frustrated, gained weight 8 kg as a result. So that is the reason it is important to mention that he was depressed and due to that he gained weight. As a result, he gained weight. Now, how you phrase this line is really important. You must link his depression with the weight gain. Now, this is very good to see that how do you write that. That's what examiner the first click here to see that how you have written this sentence. Did you correlate it and how did you write that? Okay, so I got my information from this paragraph. I'm just gonna write that he lives with wife and kids, and he was depressed to do this. Nothing else about the way. That's it. Okay, moving to the medical background. Steroids, 3 months, osteoarthritis. So probably now the surgery done. He's not taking now because that was only till November 2016. So not important. Cancel. October 2010, coronary angioplasty. Coronary angioplasty done 7 years ago. Do I have some medication to mention about that? Let me see if he's on medication. September 2010, myocardial infarction, 2001. Okay, he got this injury. All right. So I feel this medical background is not that important, only just to mention that now because he is taking medicine, so I need to mention about the cardiac problems because he is on medication. So I can just, instead of making so much line sentences that he has this problem, he takes this, I can just write he's taking Torvas and aspirin, Tylenol, this and this medication for his cardio, this anticoagulant, and his statin for this cardiac problem. All right, so I can just club this history in maximum 2 lines. So this is what is from this page. How do you club the sentence? That is transformation of the case notes. All right, so moving to the second page now. This is nursing management and progress. Of course, now this all is important. So because dry dressing changed daily, post-op complications were there, hypertension was there, so it is important to mention. For that, the stockings were issued. Then physiotherapy, again important to mention. Clinic for 2 weeks, yes, removal of the stitches. So this all I will mention. This is important. Assessment, his mobility was limited. All right, low BP, patient returned before surgery, high cholesterol, approximately 15 kg overweight. Everything is important in this paras. Discharge plan, of course, important. So now I understood, I have organized the letter. I know that what is relevant for me. Now, after reading the second stage was selection of the case notes, which I've done. Now the third stage is organizing the letter, organizing the case notes. Organizing means what I'm going to write. Now intro is very clear. Now after intro, if you remember, I always tell your purpose should be clearly mentioned in the first paragraph. That is what is the content meaning, which is the second assessment criteria of the writing. Content. Content means whatever is your purpose, you need to explain that in the first paragraph. So my purpose was, what was my purpose? Continue care. So that means I need, why the patient need continue care, that should be explained in the first paragraph. Now why he underwent surgery. So that means in the first paragraph, I'm going to write about his surgery, his hospital details. So all that will come in the first paragraph, not the social, not that. So I'm gonna write social anyway, it's not that important in this case. I'm gonna mention first about all the hospital details, that on this date he was admitted for the surgery because he was already in the waiting list for 3 years. It was a planned surgery, right? So he post-operatively he has this and this problem that I'm gonna mention in the first paragraph, because that's important. What happened after the surgery, and then if BP was low, then what you did? Compression stockings were done, and he was this medicine was started. So this is what I'm gonna write in the first paragraph. Second paragraph, that how he improved the assessment is clearly given. His mobility has improved. This and this, his all that I will write in the second, and then probably I have just 1 or 2 liner that he lives with the wife and he was little depressed due to that he gained weight. Now you need to remember there are 2 places where the weight is given. In assessment it is given 15 kg overweight, and it is given initially in the social history as well. You don't need to make 2 different sentences for the overweight, just make 1. All right, and third para is very clearly given the discharge plan. So that's what I'm gonna now. I organize the letter. Now how I transform the case notes. For that, I'm gonna see your letters. Now, please let me know. I hope the sample is clear to everyone. Yes.
Yes.
Okay. Great. So what I'm gonna do, I'm gonna now share the samples which were checked. Okay. Yeah, Bob Warren. All right, few letters are everybody sent so many letters. Let me just go through that. Okay, so this is one of the letter. Okay, let me know, guys, if you're able to see the letter. And whose letter is this? Yeah, so this was written. This is how we start the letter. We always start with the name of the person to whom I'm writing. So I will write Mrs. Gillan Doré, designation, community nurse, then address. Wherever there is a comma in the address, I will just put that in the next line. So I'm gonna put, okay, Sandhurst Medical Center, Alban Road, Sandhurst. All right. Again, a gap here, then write the date 22 February 2021. You will always mention today's date, today's. Because an exam, if you're writing your exam on 24th March 2021, you are going to mention the date of that day only. Okay, so anyhow, so this date is written here. Then again, I will put a gap. Now, some people write date first. Now, both the ways are okay. It doesn't matter where you put the date. Okay, but this is the format, right? 22nd February, comma, 2021. Then again gap, write the reference, Mrs. Bob Warren. Reference means R capital small e dots and then full name of the patient and age. So you'll write Mr. Bob Warren, comma, age 73 years. Okay, so all right, so then I will write Dear Dory. Now, Dear Mrs. Dory. Now, Dear Dory probably is not a, you can't just write Dear Dory, just write Dear Miss Dory. Okay, Mrs. It's given Mrs., so then you must mention Mrs. Dear Mrs. Dory. Now, read very clearly if you get the idea. In every way, you have to leave a space, as she left a space here. Again, after the date reference, again space, again with the dear, again one space, again leave one space, and never start paragraph from the middle. It will be very nicely and clearly and tidy writing, I would say. If you will see, this all is in one sequence. Yeah, this is what they expect you to write. So you can write, I'm writing to refer Bob Warren, who is recovering from right total knee replacement. He requires home visit for continuing care. He requires home visit for continued care is a better word. Continued care followed by his discharge today. Perfectly fine. You can either write the purpose first, like I told, I'm writing to you, request home visit for Mr. Bob Warren, who requires home visits. Home visit means one. If you will write home visit, so this is a mistake here. Home visits should be here, not home visits, because he need regular home visits for 6 weeks. All right, so that's what, then first paragraph, Mr. Warren was admitted on 12 June with diagnosis of this post-operatively. Postural hypertension was noted, for which he was commenced on this medicine, 0.1 mg daily, and advised to wear compression stocking all the time. Now, very nicely written this sentence, very simple. I mean, there's no complexity, not a compound sentence even, but very nicely and simply it is written that post-operatively, postural hypertension, always write the figure, 88/60, was noted, for which he was, for which. Now this for which is a very good, it make a complex sentence. He was commenced on this and advised to wear compression stockings all the time. Very clearly, his condition is improving as he can walk with the support of frame. Okay, you can mention that, just a line probably from the assessment, that now he can. You can also write, there's a different way to make that sentence, right? You can also write that now he can walk with the support of a frame. Okay, now that clearly indicates that it is about now. Now, Mr. Warren underwent coronary angioplasty in 2010, and he was prescribed for this and this. He was prescribed because he takes this medicine on a regular basis. The better word would be he takes atorvastatin and aspirin respectively. Now, if you want, you can add a line here that he lives with his wife and who is very supportive. You can mention about that, and was depressed for this later. Okay. Why I'm getting this call in between? Guys, if you miss, don't call separately. You must join in the group.
Okay, चल रहा
Rekha, you need to join in the group. Don't call separately, dear. I will not be able to take a separate call during the session. Okay, anyway.
I lost the internet. Sorry for that.
It's okay. So there was some background noise, so I logged it. No problem. Okay, so Nipa hasn't joined yet. No problem. Let me just call everybody once again. Okay. Yes, so I was discussing this letter. So underwent coronary angioplasty in 2010, and he was prescribed for this. Upon discharge, requires your constant motivation and exercise due to pain. Kindly monitor him for pain medication, this and this as well. All right, so this is one of the way to write this letter. So I would say yes, it is okay. You can write. Now this is another letter. I'm writing to refer Mr. Bob Warren, who's recuperating from right total. Recuperating means recovering. You can also write that word recovering or recuperating from right total replacement. He requires continued care and management followed by his discharge. Fine. So what I'm trying to say, you guys, there are different way to write and make the sentence. Right, as she has written, Mr. Warren was admitted on this and underwent the surgery for which he has been waiting since 2014. So I would say very nicely connected instead of writing that later, so which he was waiting since 2014. Okay, post-operatively she had significant, now very nicely, post-operatively he or she, I think he had significant postural, significant, that's a very nice word, significant. He had significant postural hypotension, her blood pressure was this, and it was managed with compression stockings. Apart from this, anticoagulants and other six were prescribed for him. Okay, great. His mobility is limited to walk on a flat ground by using a frame. Dressing was regularly done for him. Very nicely written. Now, Mr. Warren is a mechanic and lives with his wife. He had coronary artery disease, underwent angioplasty 2010, and takes this and this medicine. That's also important to mention. All right. So yes, the discharge, nicely written. It would be greatly appreciated. If you could visit Mr. Warren and change dressing daily till his two stitches are removed. Now, nicely connected. Please encourage him to perform the exercise. So I have given, I believe, B for this letter. So I would say a very good construction. On a few things at the end, I have written. It is important that to restrict driving. Choose a passive. Simply, right? His driving is restricted for 6 weeks. Simple line. All right, so overall, I would say very nicely written. I don't know whose letter is this. I don't remember that. But yes, I knew a few of that. Okay, so got so many letters. Oh. Okay, this was also one of the letter. This was Stuart John, all right. This is also Stuart John. Okay, now I guess we should discuss this letter. Okay, so I hope you guys got the clarity on this letter. So I have just shared the B samples with you. So everybody can write in their own way, as everybody has a different way of writing. Yeah. So I would say that try that. It is, you'll get a better idea of that, how to write, and what are the things you need to keep in mind, and how you can construct the sentence. Now that's very important. Yeah, I hope you got some idea, Rekha.
Yes, I have, Jocelyn. Thank you. Yeah.
Great. Now the second letter, now which I feel is really important because a lot of guys have confusion with this. Okay, yeah. Now this was a 31-year-old male is a patient in a medical ward of which you are a charge nurse. So it clearly says who you are. I'm a charge nurse in the medical ward. A 1 year patient is admitted. Hospital name is given Silver City Hospital, Aldaid, and the name is given Stuart John, Mr. Stuart John. Very clearly the name is given. So as I mentioned, I will just read the first line and then I'll go to the last part of the writing task, what it says. A very long letter, okay. So the writing task says, using the information in the case notes, write a letter to Mr. Matthews, senior administrator at Swall Hospital, who will be responsible for Mr. Noel's continued care at the hospital. So what I got an idea that who am I? I'm the nurse in a medical ward, and my patient is being transferred. I have to go through that. Is being transferred or shifted to the another hospital for the continued care, and I'm writing a letter to administrator, hospital administrator. Now many of you got confused that administrator means medical person or non-medical person. So Rekha, what do you think here? This administrator in the hospital is a medical person or the non-medical person?
It's the non-medical one.
Non-medical one, right? So you're writing to the administrator, right? Okay, so that's what you need to keep in mind. Then don't use any medical abbreviations, no medical terminology, which probably he will not understand. So you need to keep this in mind. There should be not a good. My letter shouldn't be only included the basic medications or these things. Probably he will not understand. So, but I have to share a good information. That's what I need to keep in mind. Okay. Now, still the purpose is written only the continued care. As I mentioned, it's not that clear. Go to the discharge plan and I will see that in discharge plan it is written regular checkups are recommended. Good nutrition, fluid, eggs, fruit, veg needs help monitoring diet. Okay, so that is favorable for dietitians. And why I'm writing this patient to admit it, it's still confused. Okay, so now I will read the whole letter to get a better hold on the letter. Yeah, sorry. So we'll read, yes. So it says that a 31-year-old male patient, he's this, name is given, marital status is given, residence is given, social history lives. Now it's going to be, if it's going to be a transfer letter, still I need to share a social history because still it is it's not a known case. In known case, I don't need to share the social history or past medical history, but still in unknown case, of course, I need to. So this seems to be unknown case. So I'm not gonna miss anything. So I will definitely tick on the social history as well. But lives with the partner for 2 years. This information is enough instead of mentioning what he or she does. Admission date is given 10th June, discharge date 16th June. That means for 6 days the patient was admitted. Diagnosis acute fever, rash, and vomiting. Now, this is what the major mistake I've noticed in the samples that you sent. You guys have written now rash, vomiting, this all seems to be like a symptoms, not the diagnosis. But yes, acute fever I can take as a diagnosis, but not the rash and vomiting. Okay, so keep that in mind. We don't mention this in the introduction. A past medical history, nil. Past surgical history, 15-year appendectomy, so probably not that important. Family history, father is hypertensive, mother is asthmatic, on treatment, so definitely I will mention that family history. Tick. Medical background, patient was tested HIV positive 3 years ago at the age 28 and now he's 31. Okay. His CD4 count was 185. Why did they measure this? The patient has been asked to return in 3 months for his usual follow-up unless he developed any complications. Now 5 weeks later, the patient has returned to the clinic. Now, very good information. Now, this is a medical background. He was HIV positive. And 2 days before, 5 weeks later, the patient has returned to the clinic with a 2 days history of fever, nausea, vomiting, sore throat, general malaise, a fine macupapular rash on his face and arms. Now I got a medical background. Okay, so this is what happened 5 weeks ago. Okay. Now remember, if patient admitted on 10th June, keep the correlation when you read the letter. Admitted on 10th June, he reported that he have this and this XYZ issues from last 5 weeks. Right? On admission, differential diagnose. Now you feel on admission, this could be rashes could be because of any food allergy, anaphylaxis, food poisoning, or adverse reaction to the ARV, the medication of HIV, or hypersensitivity to this medication. It could be anything. Appearance, looks, this, temperature, this, blood pressure, this. All right, so medication, this. All right, so how I can club this? I can just make a paragraph like patient admitted on this date, not admitted, he presented with this history, and he was basically admitted, right, for 6 days. So you can start like Mr. Stuart John was admitted on this date with this symptoms, right? On assessment, now maculopapular rashes, and these are the something which on assessment you found he looks. It is written ill-looking. What's that? Ill-looking male of average height and weight. Now, ill-looking. Instead of ill-looking, you can use the word appeared. Try to use some other words. Never use the same word what is given in the task. I can make this sentence in a better way. He appeared ill. He appeared sick. Okay, and then temperature this, blood pressure this. It seems to be all normal. Heart rate 105, so no need to mention that. So now next, what I understood from this medical background, patient was tested HIV positive. This already given. Okay, medication is this, and nursing management in progress. Okay, now what you did in the hospital during. Now in the first paragraph, I will just mention he admitted with this problem. On assessment, this and this thing was done. Okay, and then he was commenced on this and this medication. Now that is what in the first paragraph. Second paragraph now, anyhow, let me read further. It says nursing management in progress. Measure the patient's urinary output every 2 hours. That means nursing management in progress. This is something which you did in the hospital, which was done because you are writing now at the time of discharge. This all was followed in hospital earlier. So I can simply write, yes, this urine output was strictly, every 2 hours means strictly. I can just write the word strictly. Collect blood via this. Okay, that's not important to mention. Administered 1 mg IV morphine, yes, important. I will click that. Assess the patient energy level every shift. This is something important to add, so I will tick it. Assessment says patient's urinary output will maintain at least 30, all right, 30 ml. Patient was able to tolerate clear liquids without vomiting. Now this is the progress that this was on admission, and now he's able to tolerate. That will shows the contrast. But now he's able to tolerate the liquids, and intake output was monitored. That's discharge plan, regular checkups. Patient respond feeling less lethargic within 48 hours. He got better. All right. So prognosis were improving, right? So this is what now it seems to be a simple letter, but I have seen that most of you guys get confused. You guys thought that now before I start, I just want to know from you guys, what is the purpose in this letter? Can anybody just state me in one line? Anyone?
Continuing care and nutritional assessment.
Yes, continued care and nutritional assessment. Well, nutritional assessment is not, I can say yes, the continued care. Yeah, I can mention that. So, because nutritional state is something which I can correlate in the paragraphs because I need to add about the nutritional factor. So now continued care, I'm referring this patient to the other hospital. Now, is this a referral letter or a transfer letter?
It's a transfer letter, ma'am.
Yes, it's a transfer letter. Remember the safest word I told you if you're confused, it's what to write, a transfer word or a referral word, write a request word. I'm writing to request continued care for Mr. Stewart. Now, this is what I can clearly mention. I'm writing to request continued care for Mr. Stewart. He is being discharged or followed by his discharge today. Now, he was admitted or he was under treatment or he's recovering from acute fever. Okay. Now there are many things. You can either write his symptoms were suggestive of, instead of writing he's recovering from, you can also write that his symptoms were suggestive of food poisoning or anaphylaxis reaction. So this you can also mention in this because the symptoms were suggestive of that. So then in the first paragraph, you need to explain that on admission, Mr. Stewart has this and this problem. On assessment, his this and this maculopapular rashes were noted and all that. And his symptoms were he was suspected for this and this allergy. And he appeared, this will also come under the assessment that he appeared sick. He was appeared low energetic or lethargic is a better word because later on he improved. And then second paragraph, I will write about the nursing management, including the assessment and nursing management, the both I will mix. And the third, of course, is the discharge. So this is how we organize the letter. Now, main confusion which I've noticed, most of the, I won't say most of the, some of the students have mentioned in the first paragraph, they started from the HIV. Now, do you think HIV is the main problem here? The current continued care is the cause of the HIV, which he had, which is diagnosed earlier. But this continued care is for the latest condition. We are not sure it is because of hypersensitivity to or adverse reaction to this medicine, could be. Remember a golden rule, never ever start your letter with the past medical history. Never. It will never be from past medical history. So keep that in mind. And second thing, we never mix two things in the first paragraph. However, we can do that in a second paragraph. For example, in the previous letter also, we mix the past medical history and social history. We can mix these two things in the second paragraph. We can never mix any two ideas in the first paragraph. First para will be the main reason of the explanation of the purpose. Remember that. I hope it's clear to you guys. Now I saw few of the letters on this. Let's see if I get this one checked here. This is Salima added Stewart. Yeah, whose letter is this? I don't know. Let me see that. Okay, so this is how we start. As I said, we write the name of the person, Mr. Matthew, Senior Administrator, Saint 23rd Michael reached to age 31. Dear Mr. Matthew, I'm writing to refer Mr. Stuart John. As I said, it's up to you. You can write the full name or you can just write the last name, Mr. John, because you've already written the full name here. Okay, so I'm writing to refer Mr. John who requires follow-up. Now, that is also I want to mention in the letter, in the task, it was written continued care, which is follow-up, right? So better word is the follow-up. Don't write the same word. So whatever is there, just write that. And follow-up is a one word. So hyphen between the follow and up is very important. Keep that in mind always. Who requires follow-up care at your center or at your facility? I can write anything. He is recovering from viral fever or acute fever. Viral word was given, I'm not sure, and he's being discharged today. I can write in this way as well. Or I can write, Mr. John requires follow-up care at your center. He was suspected for this and this. What is the diagnosis given? He was suspected for or his symptoms are suggestive of this and this allergy, whatever is given there. Yeah. Now, Mr. John was admitted to hospital on 10 June with possible, now this is also very nicely written if you read the white fever there, with possible food allergy, anaphylaxis, or food poisoning. His assessment revealed low-grade fever and rapid heartbeat. Okay, low-grade fever and rapid heartbeat, 38 degrees and not a low-grade fever. Yes, and rapid heart rate, and subsequently antibiotics and multivitamins were started. Injection morphine was was administered every 4 hours to relieve from moderate pain. Presently, he has recovered well. Now, this is okay if I'll see overall, but I still feel in this paragraph. Now, a lot of information is missed. You didn't mention about his nausea, vomiting status. You didn't mention about his maculopapular rashes, which I think is an important indication. So you must mention that. So never miss a relevant information. So I don't know whose letter is this. If you guys know that, please note that don't miss any relevant information. Mr. John has been diagnosed with HIV for past 3 years. Okay, nice sentence, has been. So remember, we use present perfect continuous tense when something is in the past and still continued. So this is a very good sentence. Mr. John has been diagnosed with HIV positive for the past 3 years and takes antiviral medications for which regular checkup is required every quarterly. Now, very nicely constructed. This is a complex sentence, but in a very simple way. 3 year and takes antiviral. You are not mentioning the name of the medication since you're writing to a non-medical person. Keep that in mind. And takes antiviral medication for which regular checkup is required after every quarterly. Very nicely written. Kindly note that his father is hypertensive and mother is asthmatic. Kindly note. Okay, we can say that, or you can just write his father is hypertensive and mother is asthmatic. All right. Upon discharge, Mr. John requires regular follow-up. He is advised to include eggs, vegetable foods, and fluids in daily diet. So this is what is the main thing in the discharge. So I would say, yeah, nicely written. Okay, so a few things earlier also shows reluctance. His dressing needs to be changed, stitches are removed. No, this is some other letter since. Anyone else? This is Bob Warren. Okay, let me see. Yeah. Okay, so this letter, I'm writing to refer Stuart John, who is recovering from symptoms. Who is recovering from symptoms suggestive of anaphylaxis and food poisoning. He requires continued care and nutritional assessment for his smooth transition. For his smooth transition. Smooth transition. For that, he doesn't require continued care. I think this word is little unnecessarily for smooth nutrition, and moreover, nutritional assessment is not that important. But yes, if you're mentioning, there will be no reduction, but still, you can just write on the continued care or follow-up. He's being discharged today. All right, Mr. John was admitted to hospital on 10 June with the 2-day history of, okay, nicely, with a 2-day, 2 days, 2 days wrong. Day means single day. 2 days is a plural, right? 2 days history of fever, abdominal symptoms, along with maculopapular rashes on his face and arm, okay? On assessment, he had mild fever, elevated dizziness, subsequently underwent series of investigation and pain status and urine output were monitored. Subsequently, he underwent a series of investigation and he was monitored continuously. Instead of mentioning particularly, he was monitored continuously. He was lethargic, energy level. He appeared, it is written there looking, so better word is appeared. He appeared lethargic and energy level monitored in each level was monitored in each shift. You're talking about the past. Energy level was monitored in each shift. Antibiotics and multivitamin were initiated for him. For him is not required. It is understood you're writing for him. So no need to write this. You can simply write antibiotics and multivitamins were initiated along with morphine, which was prescribed 4 hourly to alleviate pain. Now he is less lethargic and able to tolerate liquids. Very nicely written. Lives with his partner, tested HIV positive 3 years ago or in 2006. Unfortunately, the test was positive. Such a big sentence and was tested. So that also is not giving the clarity. So it's better to use in this kind of a sentence present perfect tense, continuous tense. He has been diagnosed with HIV since 2006. He is on antiretroviral medication and has been on regular checkups in every 3 months. All right. It would be greatly appreciated if you could provide necessary assistance. Please note he is instructed to take plenty of food. All right, dietary this is this thing. I hope now you guys got some of the clarity. Yes. I will just take one more sample. Which one is corrected? Yes, this is, I don't know whose letter, but let me see. I'm writing to refer Stuart John, who is recovering from anaphylaxis due to food allergy. Now this, the way it is written, it shows it is confirmed, but it was not confirmed. So you need to correct this. I'm writing to refer Mr. Stuart John, who is recovering. No, we were suspecting him. No, as a nurse, I suspected him that this could be one of the cause. I'm not sure. This is a possibility. So correct this sentence. First paragraph, it is written complaints, fever, sore throat as well. This. He had presented. Avoid using past perfect tense in the starting, use simple past only. Mr. John was admitted in hospital on 10th June with the complaints of this and this you can write. With the complaints of fever, nausea, sore throat, as well as malaise and maculopapular rashes on his face and arms were noted. When you're writing and you're making it a compound sentence, that means you need a subject and make that in passive. So that is why word noted was important at the end. On assessment, his temperature was 38 degrees Celsius. You can simply write C, don't unnecessarily pulse. He was diagnosed with viral fever. Now this what was the diagnosis? That's what I've corrected here. Avoid writing the name of the medication because it's a known medical person. The next day he was able to tolerate. You don't need to mention so specifically that next day only he started. You can simply write, morphine, this, cut short this because this is a very long paragraph. So cut short it. You can simply write, subsequently he was commenced on this medicine along with the morphine. Now he is able to tolerate clear liquids. If there are no abdominal symptoms, you don't need to mention. Don't write anything extra. Okay, just if you write now, that means present. You can simply write now he is able to tolerate liquids, clear liquids. Okay, so has been, I have corrected here also. checkup every 3 months, not monthly. Okay, so I think just keep in mind, and that's the reason this letter got C plus. So make sure that you write a proper sentence. So that is very important. This is again Stuart John. We have written acute fever, and he requires never write a combined word like acute fever because both the words are different from an acute fever is absolutely wrong. We never used with the noun the article. He was recovering from acute fever and he requires your continued care. He's being discharged today. All right, so she has also written in a simple way on examination which revealed food energy. Now, this is wrong, where the way it is written which revealed food energy. No, it was not confirmed. You suspected. You can basically write that Mr. John was admitted on 10th June. His symptoms were suggestive of food allergy or so and so. Yeah, so that you can write it down. And avoid the medication name that you have written because you're writing to the non-medical person. Add morphine in the first para instead of making this as a second. And then this would be your second paragraph about the past medical and social history. Okay. So you have to, and that's why you didn't get the B here. So keep that in mind. Yeah, so this letter is also seems to be okay. Stuart John, who's recovering from viral fevers, required this and this. Admitted with this food allergy and examination. All right, so I've corrected these letters in the scoring as given. Those who didn't get B in the letters, I want them to write again. And I believe you guys have now the clarity. And those who have not written this letter or those who did not get B in the letters can write that again. Yes? Yes, Biju. You want to say something? Sheena's hand is also raised. Sorry, I didn't see just now. Yeah, Sheena, tell me first.
Oh, I said okay.
Okay, I thought you raised the hand. Yes, Biju, your hand is also raised.
And no, ma'am. Actually,
Rashmi muted Biju.
I'm sorry, mistaken.
He was saying something and you muted him. So are you doing this on duty as well?
Oh, no.
it's okay, Rashmi. Ma'am, actually, I raised because I was telling that that Bob Warren's letter you discussed the second. That was my letter. You were asking. That's right.
Okay. So I hope now the things are clear to you that where to use which tense. Anything which is, in the past and still always use without any hesitation, always used either has been present perfect continuous or he has had, that is present perfect tense.
Ma'am, one
Never
doubt.
describe this in the past. Yes.
Ma'am, is it mandatory that we have to write social history for all unknown cases?
Mandatory. Now, this is a good question. Nothing is mandatory, but something called relevancy, if it sounds, because somebody is going to visit your house. So just give a liner if you feel that it is not important. Just give a liner that he lives with wife who's supportive. So I'll get some idea. Maybe if I'm a community nurse and I'm going for the dressing, I can teach that person because you have given me indication that wife is supportive.
Okay.
Okay, so when I'm going to visit the person's house, then the social history is bit important to know who all are there at home.
Okay. Okay.
Okay, same way if I'm writing to a social worker, then even to knowing about the patient's social habits, it all sounds important on a point of view of social worker. Okay, I hope it's clear to everyone.
Ma'am, I have one doubt, ma'am.
Yes, please.
Ma'am, if in the case note, if we have too many information, then the paragraphing, how much line should be there in the paragraph? Is there any
Okay.
particular-
So yes, make sure your introduction should not be more than 25 to 35 words, which comes approximately 3 to 4 lines. And a first paragraph again comes to 5 to 6. I mean, not much lengthy, but yes, the third discharge paragraph can go up to 70 to 75 words. The rest all is between 35 to 45 words.
Okay. Okay.
Intro and the last final request could be just 25 words, and rest of the first and second paragraph could be of 35 to 45 words, and third para, which is the discharge, because sometime in a task there are a lot of discharge information that can go up to 70 to 75 words. So if you will just calculate in that way, it will take you to exact 170-80 words.
Okay.
So we have to make only 3 paragraphs: introduction, nursing notes, and discharge.
No, I didn't say that. See, any person, there has to be like at least 3 or 4 paragraphs. I'm not counting intro as a paragraph. First, you will write introduction. After the introduction, the same way, like I will show you again the picture of. One minute. Wait a minute. Let me just share one. Not getting an A4 size. Yes, I was saying like first it has to be introduction, and then it has to be your first paragraph, and then second paragraph. Let me just share the screen. Yeah, I hope you can see the screen now. So like this is what is important. Like from where we start here, that Mrs. Gillian Dorsey, from the name of the person to whom I'm writing, till this age is the first part of your letter. It is not counted because your letter should have 180 to 200 words. This paragraph will not be counted till here, age 23 years, whatever, 73 years. So counting will start from introduction. Like 3 lines are there in introduction. I'm writing to refer Bob Warren, which is fine. Then again, give a gap of 1 line, and then first paragraph is the explanation of the current problem. My purpose will always be current issue, right? And my first paragraph, I'm writing to explain the main reason of behind the purpose. What is the main reason? Why this patient need continued care? In the first paragraph, I'm going to explain that after the intro.
Okay.
Okay, and the second para consists of, if it is a referral letter, of course, I mean the known case or unknown case. So the known case means to whom you are writing, for example, GP. You are writing to a GP. Now GP knows the patient already. Yeah, in that case, you don't need to write about the social history and past medical history. So that means in that letter, in the second para, you will write about the hospital management, whatever the management was done in the hospital. And then third para would be discharge plan. So after the introduction, there will be at least 3 paragraphs.
Okay, yeah, then it becomes, yeah. Okay, yeah. Thank you.
So if it is an unknown case, then your second paragraph it is not compulsory that, you will always mention the second paragraph as a social or past. If you have something other important thing, you will mention that, and later on you can write about the social history, just to give a heading, maybe just a liner that he lives with his wife, who's supportive. That's it. Right? I hope it's clear to everyone.
Justly, I need that reading paragraph C as well, if you don't mind. Could choose one day to do it, if you don't mind.
I didn't get what you're saying.
If you could kindly one day arrange the class for paragraph C reading.
Okay, part C reading. So we have
Yes.
done recently. I think I shared. Did you go through that video?
I know, I saw it, but still I didn't get through.
No problem.
Still
I'll take that
I'm
again. Yeah,
struggling.
no problem. Yeah,
Yeah.
no problem. We'll do that.
Thank you.
Okay, so guys, I hope it's clear to you. Anyone has any questions? No? All right, thank you so much for taking out your time. And
Thank you.
we'll see you tomorrow morning. And I give a group call in the morning. So Rekha, you will definitely get the call, but it's up to you. You want to take that call or not. I understand it's early in the morning at your side, but it's a group call, so we'll go to everyone.
Okay, that's fine.
Yeah.
Yeah.
I just saw your message in now in the Skype that you were asking, that you were saying that it's early morning here, so that's why.
It's okay.
Okay, guys, then see you tomorrow.
7.
Bye-bye, and then take care. And those guys, I don't know, but yeah, so let me know about your plan. Those who joined me on 2nd February, I believe your month is gonna end. So yeah, you can join me tomorrow as well, and then let me know your further plans.